Hi everybody and welcome to the launch of Psych Nurse. This is going to be the go-to blog for all you budding mental health nurses out there. My name's Mark Kay, I am a mental health nurse, and I'm hoping that this regular blog will be of interest to people that are in mental health and are nurses, or are student nurses training to be mental health nurses, or maybe you work in the general setting and you want to get more familiar with mental health nursing because you want to do some extra shifts there, or maybe you just got a general interest in it and you just want to see what psych nurses do.
You run one of Britain's busiest casualty departments. Your team is 2 staff down. You need someone to come in and make life or death decisions, coolly and decisively. You found a motivated, talented candidate who has all the qualities you're looking for. But they have a history of mental health problems, including periods of serious depression. So would you give them the job? Well,
I'm just getting used to doing this blogging lot, so you'll have to sort of get used to me. My eyes will sometimes go down because I am reading stuff. I'm trying to make it as natural as possible, but until I sort of get the hang of things, I'm probably going to find it a little bit difficult to start with.
if you wouldn't, congratulations. You just turned down Florence Nightingale. Don't let your attitudes to mental health conditions stop you making the most of people's talents.
Okay, here's a fact for you. Mental health disorders affect 1 in 4 people worldwide. That's 450 million people that are affected by mental illness. Wow, that's a lot of people, isn't it? And actually, when you look at the, organisations like World Health Organization, for instance, they talk about mental health disorders being the leading cause of illness globally as well. So, that kind of puts in perspective just how important, the need for clinicians in mental health and, the need really on the services that provide health services. They need health professionals that can work in mental health. So, when you look at those sorts of things in that sort of sense, the psych nurse or the mental health nurse, whatever you want to call yourself, a registered psych nurse, a mental health nurse, you're really important. There's lots of people that are taking care of mental health patients that perhaps have less exposure, a lot less exposure to mental health disorders, and also that have lacked that training to actually talk to people that have a mental illness. And, so they don't have that academic background, which I don't want to say that this site is an academic background, but you still need to be registered as a psychiatric nurse to practice mental health, or you need to be registered as a mental health clinician. And of course that can be different disciplines, but predominantly it's always been a psychiatric nurse, mental health nurse. So, I guess that's something to think about, isn't it? You're looking at mental health nurses and you say, well, what's the point of them? There's a massive point to them. And, when you consider how much of funds or grants and gifts from the governments that around the world that give to health services to help them run the services or provide the means to run the services, how little that fund availability is to mental health. So it kind of makes you wonder, kind of makes you think about things, doesn't it? I'd like to believe that our services have moved on from asylums, at least. And we treat people in the community and we try to normalise their condition as much as we can. We've tried to move away from heavy sedation and allow people, I guess, to somehow perhaps achieve their full potential to a certain degree. And there's been lots of evidence and from personal experience where things have actually worked out really well for patients. Patients that I've treated or patients that I've been part of treating, and they have managed to live a standard of life that they feel content with. And I guess we try to offer a fairer type system, and we talk about least restrictive practice. So I guess you know, on paper, it looks like we're actually doing quite well with patients, and you know, I'd like to believe that some of my day when I'm working in mental health is actually quite meaningful and positive. But I think mental health services on a whole have a long way to go, and that's, you know, that's not such a bad thing. You know, we're still in its infancy, really, and you know, treating people with mental health is not easy. You know, it's not something that, you know, you can go to your doctor. He takes a photograph of your brain. He says, "All right, okay, yeah, you're full up with a bit of delusional stuff there. Let's see if we can bring it down with this by pressing this button, by pressing that button, or injecting that medication. We can see from our scan that you're actually better now, and you can go home." You know, it's not as tangible as that, and in some ways, I guess it's kind of like a guessing game, really. You know, medical doctors will diagnose people and offer a course of treatment, but there's no guarantee to that treatment actually working. As you know, there isn't a one-size-fits-all mental health patient. You know, just because one person suffers with schizophrenia and another person suffers with schizophrenia, they don't necessarily have exactly the same symptoms and the way of coping and dealing with it and recovery time. You know, yeah, they may have some similarities in, you know, what they. So being a mental health nurse, mental health clinician, you know, it's a very complex subject, and it's not something that you can take lightly. You know, I've worked with many individuals over the years, and I've worked with the most vulnerable people, and I've worked with I've worked alongside people who have valuable and extensive experience and exposure, and have some really positive things to offer you as you go along. And you'll find that, you know, as you're studying and as you go on, what will happen is that you'll start to take on the relevant bits of information that you receive, and usually it's the stuff that resonates with you, and everything else sort of becomes in the background, something you just don't take on board. You know, that white noise that sometimes is quite dominating in conversation, negative responses, people that are perhaps disillusioned with the places they work, or perhaps they've just had enough of working in mental health, or, you know, or are close to retirement or something like that. I'm not going to use the word burnout because I don't believe in the word burnout, and perhaps one of the blogs I'll explain what that means. But at the moment, I'm just going to say that, you know, these people perhaps don't come across with things that are helpful and useful. They just become white noise, and as you get more and more experienced, your white noise radar will get bigger and bigger and bigger, and you'll only take the stuff that's resonates with you, and it's something that motivates you. So you absorb this stuff, and you ignore the rest. So I guess when you're looking at this blog site, I'm hoping it's going to be something that's going to be positive for you, something you can refer to over time, something you can go back and look on again, and something that resonates with you, and that's what I'm hoping that it's going to bring. You know, I'm hoping that by doing that perhaps, one, you'll feel supported within your workplace, and feel you know, that you can justify, you know, how you act and how you should be, and, you know, and stop doing the stuff that you shouldn't do. You know, learn about people, learn about how to treat people in hospital, learn how to treat people in the community, and different settings. And I'm hoping that you know, it will encourage meaningful engagement with your patients as well. You know, we live in a world that travels so fast, and it's hard to keep up with life sometimes, isn't it? And the people in it sometimes get either left behind or neglected. So there is a small percentage in comparison. 450 million out of 7 billion is, you know, probably a small percentage, but it's still a percentage of people that we as mental health clinicians, and particularly mental health nurses, can address and help with. You know, so, you know, I think this is going to be an exciting series to actually look at from a mental health perspective, and I'm hoping that you get something out of it. And you know, if not, let me know, and I'll see what else I can come up with. I just want to try and make it as interesting and as fun, really, as it can be, and, you know, without taking away the seriousness of what we actually do and how we practice. I still think there's room for humour and it doesn't have to be so academic. You know, after all, we're dealing with people. We're not dealing with people that speak another language. We're dealing with people